Hi, my name is Pavan Gill, and I'm currently a fellow at RMA New Jersey here in Basking Ridge. And today I'd like to talk to you about one of the studies I was involved in, specifically looking at the role of leukocytospermia in IVF cycles. So as we know, male factor is an important equation in terms of infertility. And what we wanted to look at was to see whether the prevalence of leukocytospermia influences IVF outcomes. This was a large retrospective study that we did where we looked at over 5,000 cycles between 2012 2021, so a 10-year time span. And over that time period, we wanted to look at whether the presence of leukocytospermia within 3 months prior to a patient's IVF cycle impacted any clinical outcomes. So specifically looking at embryological outcomes, including fertilization rate, blastulation rate, and aneuploidy rate, and then also looking at clinical outcomes, including clinical pregnancy rate, live birth rates, and clinical loss rate. Overall, the findings were very reassuring. When we compared groups with leukocytospermia to those without leukocytospermia, we found that the fertilization rate was comparable with no significant difference. We also found that the blastulation rate and clinical outcomes were also very comparable. So overall, this is very reassuring data that we can share with our patients. Interestingly, a novel part of our study was looking at the aneuploidy rate in the leukocytospermia group versus the non-leukocytospermia group. The reason we wanted to look at this was that leukocytospermia has been proposed to potentially impact reactive oxidative species prevalence and thereby impact potentially DNA fragmentation, which could potentially increase aneuploidy rate. In our study, we did find that there was a slightly higher rate of aneuploidy in the group that had leukocytospermia, but importantly, this was not significant. Overall, I think that our research is very helpful in counseling patients, especially those who have asymptomatic leukocytospermia before an IVF cycle, and letting them know that prevalence of this is likely to have no negative impact with respect to outcomes. And importantly, these patients probably don't need a long course of antibiotics before undergoing their treatment. Thank you to IVI Global for helping support this project.